This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning, everybody. So I think we're all probably painfully aware that opioid overdose deaths have significantly increased in general over the last, 10 years or so. I saw an estimate that in 2023, 17% of out-of-hospital cardiac arrests across the country were related to opioids. I think we all also know that Naloxone is a great treatment for opioid overdose, but there's question as to whether treating actual cardiac arrests with Naloxone is beneficial or not. There's not great prospective, randomized trials to look at this, but there were two studies that were recently published trying to, look back at some data and see if there's benefit to treating cardiac arrest with Naloxone. Overall, it did look like there could be some benefit. One of the trials showed that the rate of ROSC getting circulation back and hospital discharge was improved if Naloxone was given, whether overdose was suspected or not. And then there was another trial that showed that Naloxone given early, so like bystander giving intranasal Naloxone before EMS even got an IV or an IO, actually improved good neurologic outcome discharge. So it's not great studies, but Naloxone is very benign. So I think that if somebody has a non-traumatic arrest and there's any suspicion of possible opioids, and sometimes it's surprising to people that accidentally get too much opioids. It doesn't have to be someone who looks like an obvious, drug user. Sometimes people get a prescription. Sometimes people take too much of, the oxycodone they were prescribed. So I think it's pretty reasonable to try it in cardiac arrest situation to add to potentially to the medications that we give. Any questions or comments? No, there's no adverse effects. Someone's dead and then wakes up and starts vomiting, that's okay. So yeah, no, I mean, theoretically, in cardiac arrest, there's always the risk that you're going to give a medication that's going to maybe bring somebody back, that's going to keep them alive for another couple of days, but then they don't actually recover and they don't have good neurologic outcome. I think that's hard to say at this point that this would be that. I think if you give Naloxone early, if it has benefit, I think it's definitely worth trying.
What's the dosage you would recommend?
I'd probably go 2 or 4 milligrams, and if there's a high suspicion that somebody's a known user, somebody said they may have used some synthetic, then I would in those sometimes you have to go higher, 4, 8, but you can't go too high in this situation. It's not like one of these situations where someone's a chronic user and you don't want to cause too much withdrawal symptoms. You just want to go big. Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.